The first thing we should do on the patient is to put the elastic separators. After a week with the elastic separators placed, we are able to cement the bands. Now we proceed to remove the elastic separators. For a proper placement of the brackets, we use the guidance lines designed and described by Andrews, in which we have first the major axis of the tooth and then the center of the clinical crown. From this initial tooth point, we describe the proper height on the rest of the teeth. To avoid contamination with saliva during the bonding, we recommend to use a cheek retractor that helps us to have an isolated work field. To have the best adhesion, we should prepare the enamel surface by etching it with a 37% phosphoric acid for 30 seconds. After 30 seconds with the acid, we can proceed to remove it. After the acid etching, we put the light-cured adhesive for a proper adhesion. We have treated the minimum area occupied by the bracket, trying not to affect the rest of the tooth with the etching acid or the adhesive. We take the bracket that should be placed on the prepared tooth and we put composite for its adhesion. We should place it at the center of the clinical crown. And then we have to check both height and angulation. Once we have checked height and position, we should remove the excess of composite and press firmly to remove any excess that can produce an error during the bracket placement.
que nos produzca algún error de colocación del bracket. Y a continuación,
And then we can light cure.
vamos colocando los
Keep on placing the brackets in their corresponding heights,
y a sus alturas correspondientes
those heights that we had determined on the working
en el
casts.
modelo de trabajo. Vamos cementando el resto de brackets
We would cement the rest of the brackets to complete the arch.
hasta completar la arcada. Por último,
Finally,
una vez colocados los
once the brackets are placed,
colocamos
we
un
put
arco
a super elastic nitinol arch wire
para
to align all
alinear
teeth.
todos los dientes. Lo
We have
cortamos
previously
sobre el
cut the
modelo
arch wire
para
on the
los
model
puntos que
casts
necesitaremos
in order
enmarcar.
to have the proper length at the placement on the patient. We place the arch wire with the Vinegard pliers, in this case on aesthetic ceramic brackets. Once the arch wire is placed in the mouth, we can proceed to tie it with metallic ligatures with the help of mature pliers. We should assure that it is well adapted with the help of a guide as we are tying the arch wire. Once all is set with the metallic ligatures, we cut the excess of ligatures, and then again with the Vinegard pliers, we should bend inward the remaining parts of the ligature.